Cardiologist warns, never take B12 with these two common medications after 60. For many individuals in their golden years, the morning routine often includes a daily vitamin B12 supplement, a practice widely believed to support overall health and vitality. However, before reaching for that next dose, it is crucial to understand potential interactions that could be silently undermining well-being. Across the nation, millions of older adults are unknowingly facing an elevated risk of serious cardiovascular issues, even as they diligently follow what they perceive as beneficial health regimens. This silent threat often presents no immediate symptoms, no discomfort, no dizziness, no alarming chest sensations that would prompt an urgent call to a healthcare provider. Yet, beneath this seemingly calm surface, the subtle interplay between common supplements and certain medications could be contributing to an increased likelihood of stroke and significant heart damage. Vitamin B12, a nutrient often praised for its vital role in nerve function, red blood cell formation, and DNA synthesis, is rightfully considered a cornerstone of many supplement routines, particularly for those over the age of 60. Its widespread availability and perceived benefits have made it one of the most trusted dietary additions. Nevertheless, even the most beneficial substances can become problematic under specific circumstances. A critical, yet often overlooked interaction occurs when B12, especially in higher doses, is combined with certain commonly prescribed medications. This combination, rather than augmenting health, can paradoxically introduce an unforeseen danger, leading to a cascade of effects within the body that could have serious long-term consequences for cardiovascular health. Many individuals pursuing optimal health through supplementation remain unaware of these crucial interactions, highlighting a significant gap in widely disseminated health information. This concern arises because the combination of high-dose B12 with one of two specific, widely used medications can trigger the formation of a molecule known as homocysteine. Homocysteine, in elevated concentrations, behaves much like abrasive sandpaper against the delicate inner lining of the arteries. This persistent irritation can dramatically increase the risk of stroke and other cardiac events. The nuances of this interaction are not always discussed during routine medical consultations, leaving many individuals uninformed about potential risks. This discussion aims to shed light on which two medications are particularly concerning when taken with B12 after the age of 60, and, more importantly, to provide clear, actionable steps on how to effectively safeguard your health against these potential dangers. Understanding specific health interactions is immensely valuable. Before delving deeper into these critical physiological mechanisms, it is important to reflect on personal health practices. Many insights into how the body responds to medications and supplements are often illuminated by studies that uncover surprising findings. For instance, a significant study published in a leading medical journal revealed an unexpected outcome for older adults. This research indicated that seniors who consistently took high doses of B vitamins, including B12, over an extended period actually demonstrated an increased cardiovascular risk under certain conditions rather than the anticipated decrease compared to those receiving lower doses. This finding initially caused considerable surprise within the medical community. However, upon closer examination of the underlying biological mechanisms, the results become entirely understandable and logical. To illustrate this complex interplay, consider the story of an individual named Dorothy. Dorothy, at 71 years old, was remarkably sharp and active, a retired school teacher who diligently maintained her health. Her daily routine included a morning walk and a regimen of various supplements taken with breakfast. She adhered to these practices because she had learned that after the age of 60, the body's ability to absorb essential nutrients typically declines. Vitamin B12 was prominently featured on her supplement list, and she took pride in her proactive approach to health management. Unbeknownst to Dorothy, however, she had been taking metformin for type 2 diabetes for nearly 8 years. Throughout this extended period, no healthcare provider had comprehensively explained to her how metformin affects B12 absorption over time, nor the crucial implications of the body's compensatory mechanisms in response to these changes. Over recent months, Dorothy's daughter began to notice that her mother seemed more fatigued than usual. This wasn't merely the sleepiness that a good night's rest could resolve. It was a profound, persistent drain that left her feeling exhausted regardless of how much she slept. Dorothy, attributing this to the natural process of aging, dismissed her daughter's concerns. When comprehensive blood tests were eventually conducted, including a specific measurement of her homocysteine level, the results painted a clear and concerning picture that reflected a growing trend among seniors. Her homocysteine levels were dangerously elevated. Paradoxically, her B12 levels were quite high, a direct result of her consistent supplementation. Yet, these two findings, when considered together, narrated a compelling story of silent vascular damage that had been quietly progressing for years, all while Dorothy believed she was doing everything correctly to protect her health. This narrative underscores the critical importance of understanding medication interactions and their subtle, long-term effects. Let's delve deeper into the precise physiological processes occurring within the body and explore why the combination of B12 with these two specific medications creates a problem that routine medical checkups often fail to detect. The first medication of concern is metformin. If you live with type 2 diabetes, there is a very high probability that you are currently prescribed this medication. Metformin stands as one of the most frequently prescribed drugs in many countries, widely recognized for its effectiveness in managing blood sugar levels. While its efficacy in diabetes management is undisputed, metformin carries a side effect that, unfortunately, is not always thoroughly communicated to patients. Over extended periods, particularly when taken for several years, metformin systematically interferes with a crucial protein produced in your stomach called intrinsic factor. Intrinsic factor plays an indispensable role in the absorption of vitamin B12. It functions much like a dedicated transport vehicle or a taxi for B12 molecules. Once B12 enters the digestive system, it needs to bind with intrinsic factor to be effectively carried and absorbed into the bloodstream, where it can be utilized by the body's cells. Metformin, through its long-term action, subtly impairs this vital transport system. It renders the intrinsic factor less efficient and less reliable in its function. Consequently, when a healthcare provider observes low B12 levels in a patient taking metformin, the common recommendation is often to take a B12 supplement. Patients following this advice frequently opt for high-dose B12 tablets, operating under the reasonable assumption that more is better for addressing a deficiency. Initially, this approach appears to work. Blood levels of B12 rise, and the doctor might conclude that everything is satisfactory based on these standard measurements. However, these surface-level blood test results often fail to reveal the critical processes unfolding further downstream within the body. When B12 cannot be properly processed and transported due to the compromised intrinsic factor system, it begins to interact in an unfavorable way with another molecule present in the blood, homocysteine. This is precisely where the situation transitions from a simple nutrient deficiency to a genuinely dangerous health concern. Homocysteine is a naturally occurring amino acid produced by the body. In small, balanced quantities, it is harmless and serves various physiological functions. The body typically employs B vitamins, specifically B12, B6, and folate, to efficiently convert homocysteine into other useful compounds and clear it from the bloodstream. However, when this crucial conversion process is disrupted, either because the B12 is not being adequately absorbed or not being properly processed due to impaired intrinsic factor function, homocysteine begins to accumulate. Elevated levels of homocysteine in the blood trigger a very specific and highly damaging effect within the cardiovascular system. It effectively acts as abrasive sandpaper on the delicate interior walls of your arteries. This persistent abrasion has profound implications for arterial health. As described by researchers, elevated homocysteine does not cause an immediate, sudden blockage like a blood clot might. Instead, its effect is one of chronic, sustained irritation and abrasion. It causes inflammation within the arterial wall, leading to a gradual stiffening of these crucial blood vessels. This continuous irritation also makes the arterial walls more susceptible to the formation of atherosclerotic plaques, and it impedes the natural ability of the vessels to expand and contract, a vital function for healthy blood flow. To visualize this, consider your arteries as flexible rubber hoses. In a healthy state, they possess elasticity, stretching and rebounding rhythmically with each beat of your heart, adapting to changes in blood pressure and flow. However, when homocysteine has been persistently scraping and inflaming these walls for months or even years, the metaphor shifts. The artery begins to resemble a rigid plastic pipe. Unlike flexible rubber, rigid plastic pipes are brittle. They do not flex under pressure. Instead, they are prone to cracking or breaking. Within the intricate cardiovascular system, such a rupture or break can manifest as a stroke or a severe cardiac event. It is a sobering question to consider how many individuals have been taking metformin for more than 3 years while also routinely supplementing with B12. This combination is occurring in countless individuals daily, and the crucial connections between these factors are often tragically missed until a serious event occurs. Now, let's turn our attention to the second medication that requires careful consideration. This particular class of drugs is even more widely used than metformin, and its interaction with B12, while different in mechanism, can be equally, if not more, unpredictable in its outcomes. We are referring to proton pump inhibitors, commonly known as PPIs. These medications include familiar names like omeprazole and pantoprazole, and their primary function is to significantly reduce the production of stomach acid. They are frequently prescribed for various gastrointestinal conditions, including chronic acid reflux, healing damage caused by excessive stomach acid, and protecting against ulcers. Their widespread use, especially among older adults, is notable, partly because acid reflux and other digestive issues tend to become more prevalent after the age of 60, as the digestive system naturally undergoes changes. However, PPIs exert an effect that is rarely highlighted or explained at the pharmacy counter, yet it holds significant implications for nutrient absorption. These medications reduce the very stomach acid that is fundamentally necessary to release vitamin B12 from the food we consume. Our bodies require a sufficiently acidic environment within the stomach to break down the protein bonds that securely hold B12 within various food sources. When this crucial acidity is diminished over months and years of consistent PPI use, the absorption of dietary B12 drops significantly. A comprehensive study published in a respected medical journal tracked over 25,000 patients undergoing long-term PPI therapy. It unequivocally found that after just 2 years of continuous use, patients taking PPIs consistently exhibited measurably lower serum B12 levels. Following such a finding, what is the most common response from healthcare providers? Often, it is to recommend a B12 supplement, a seemingly logical solution on the surface to address the observed deficiency. Yet, here lies a critical nuance. In certain individuals, particularly older adults whose kidney function may be naturally reduced with age, the B12 supplement is not processed and cleared from the body as efficiently as it should be. Instead, it can accumulate in the bloodstream in a form that interacts poorly with the delicate homocysteine cycle we have just discussed. This accumulation can exacerbate the very issue it is intended to resolve. Even more concerning is a phenomenon observed in some patients on long-term PPI therapy, the development of rebound acid hypersecretion. This means that when the medication is stopped, or even as it metabolizes overnight and its effects wane, the stomach paradoxically overproduces acid as a compensatory response. During this specific rebound window, the high-dose B12 supplement, which is still circulating in the system, is processed within an exceptionally unpredictable digestive environment. This leads to erratic absorption of the B12. And crucially, erratic absorption directly translates to erratic management of homocysteine. Some days the body's system might effectively clear homocysteine. On other days, it struggles significantly. This inconsistent processing creates fluctuations that can be detrimental over time. It raises an important question. When was the last time your healthcare provider specifically inquired about whether you were simultaneously taking a PPI and a B12 supplement? For many, the answer is likely never, highlighting a significant oversight in routine patient care regarding these common drug-nutrient interactions. Now, let's integrate all the information we have covered, bringing these crucial pieces together to form a clearer picture. The core of this entire health concern revolves around the homocysteine connection. Homocysteine levels are one of those vital indicators that are almost never included in a standard blood panel. Typically, your doctor will check your cholesterol profile, your blood sugar levels, thyroid function, and perhaps even your total B12 level. However, a homocysteine level requires a specific, separate test that must be explicitly ordered. A renowned medical institution has identified elevated homocysteine as a significant and often under-recognized risk factor for cardiovascular disease in adults over 60. Despite its critical importance, the vast majority of older adults have never had their homocysteine levels tested throughout their lives. Understanding why this matters so profoundly is crucial. When your homocysteine levels remain consistently elevated over many months and years, a cascade of three distinct damaging events unfolds within your cardiovascular system. Firstly, the delicate inner lining of your arteries, known as the endothelium, becomes chronically inflamed and begins to lose its natural, smooth, non-stick surface. This loss of smoothness is critical because it makes the arteries more vulnerable. Secondly, tiny oxidized particles of LDL cholesterol, often referred to as bad cholesterol, find it much easier to embed themselves within these inflamed and roughened arterial walls. This embedding is the foundational step in the formation of arterial plaques. Thirdly, and perhaps most perilously, the plaques that develop within an inflamed, high homocysteine environment are intrinsically more likely to be unstable. Unstable plaques have a dangerous tendency to rupture or break off from the arterial wall. Instead of remaining in place, these fragments can then travel through the bloodstream. This final point is particularly critical because it provides an explanation for strokes that occur in individuals who, upon imaging, show no major blockages in their arteries. The underlying cause was not mysterious. A plaque was indeed present, but it was unstable, broke loose, and traveled to the brain. Researchers at a prominent medical clinic have repeatedly found elevated homocysteine levels in a disproportionate number of these so-called unexplained strokes. The cause was not an enigma. Rather, the appropriate diagnostic test was simply never ordered. This information is not intended to instill fear without purpose. Its true aim is to empower you with knowledge, returning control over your health back into your hands. Now that you possess a deeper understanding of the intricate processes unfolding within the body, let's explore the actionable steps you can genuinely take to mitigate these risks. The solution is not to completely abandon B12 supplementation. On the contrary, vitamin B12 is an absolutely essential nutrient, especially for individuals over the age of 60. A deficiency in B12 can lead to a host of serious health problems, including nerve damage, profound fatigue, cognitive decline, and indeed, it carries its own distinct cardiovascular risks. Therefore, the objective is not to reduce your B12 intake, but rather to adopt a smarter approach to B12 supplementation. First and foremost, if you are currently taking either metformin for diabetes management or a proton pump inhibitor, PPI, for acid reflux, the single most important action you can take right now is to request that your healthcare provider test your homocysteine level. In addition, ask for a test of your active B12 PET level. It is crucial to distinguish this from a mere total B12 measurement in the blood. A total B12 level can often appear normal, masking an underlying deficiency in active B12, which is the specific form your body can actually utilize. This distinction is critical for an accurate assessment and is often missed by standard laboratory panels. Second, the form of B12 you supplement with matters enormously. The vast majority of B12 supplements readily available on store shelves contain cyanocobalamin. While it is the most inexpensive form to manufacture, it requires your body to undergo several complex conversion steps before it can be used effectively. For older adults, particularly those taking metformin or PPIs, these internal conversion pathways are frequently compromised or less efficient. In contrast, the form known as methylcobalamin bypasses most of these conversion steps because it is already in an active, biologically usable state. Research published in a European Journal of Clinical Nutrition has affirmed that methylcobalamin reliably raised functional B12 levels more effectively in older adults compared to cyanocobalamin when administered at equivalent doses. Third, the dose of your B12 supplement is far more significant than many people realize. It is common to find and take high-dose B12 supplements ranging from 1,000 to 5,000 micrograms daily. However, without a fully functional intrinsic factor system, the body can absorb only a very small fraction of these extremely high doses. The excess B12 then floods the bloodstream in a form that may inadvertently contribute to the homocysteine imbalance we have discussed. A more targeted and effective dose, typically in the range of 250 to 500 micrograms, delivered in the methylcobalamin form, when combined with appropriate B6 and folate supplementation, provides the homocysteine cycle with precisely what it needs to function optimally without overwhelming the body's natural processing capabilities. Fourth, it is absolutely essential to engage in a specific and detailed conversation with your healthcare provider about your complete list of medications in relation to your supplement regimen. Do not treat this as a casual passing question at the end of an appointment. Instead, make it a primary agenda item for your next visit. Clearly state, I want to have a thorough discussion about my B12 supplementation in the context of the medications I am currently taking. This dedicated conversation alone has the potential to profoundly alter the trajectory of your cardiovascular health by addressing these critical, often overlooked interactions. Consider the powerful story of Beverly, an experience that serves as a profound reminder of these principles. Beverly, at 74 years old, had been taking a proton pump inhibitor for a remarkable 14 years. And for the last 5 of those years, she had also been diligently supplementing with B12. Her daughter, having encountered informative content about homocysteine and heart health, proactively brought her mother in for a consultation armed with a printed article. Beverly herself was initially quite skeptical. She felt perfectly fine, her blood pressure was well managed, and she enjoyed walking her dogs every single day. Yet, when her homocysteine levels were tested, the result came back at 31 micromoles per liter. To put this in perspective, the generally accepted safe range is below 15. At 31, Beverly's level was more than double the threshold associated with a significantly elevated risk of stroke. Despite this alarming number, she exhibited no symptoms, experienced no warning signs, and had no inkling of the silent danger within. It was simply a number on a page, yet it precisely explained why her arteries were enduring far greater strain than they should have been. Following this revelation, specific adjustments were made to her supplement regimen. The form of her B12 supplement was immediately changed to methylcobalamin, which is readily usable by the body. To further support the crucial homocysteine conversion pathway, a low-dose B6 and folate supplement was also introduced. Additionally, the timing of her B12 supplement intake was strategically adjusted to be separate from her PPI dose, aiming to maximize whatever absorption was possible. A follow-up homocysteine test was scheduled for 90 days later. When Beverly returned 3 months subsequent to these changes, her homocysteine level had dropped significantly, reaching 17. While not yet perfectly within the optimal range, this represented substantial progress, moving in precisely the right direction. Reflecting on her experience, Beverly remarked that she hadn't truly realized how deeply tired she had felt until she began to experience a noticeable reduction in that pervasive fatigue. If you have been following a similar regimen for years, it is crucial to understand that it is absolutely not too late to make beneficial changes. The human body possesses a remarkable inherent capacity for recovery and rebalancing when provided with the precise support and nutrients it genuinely requires. The vascular inflammation and damage instigated by elevated homocysteine are not necessarily permanent, particularly when identified and addressed before a major cardiovascular event occurs. Beverly's experience serves as compelling proof of this restorative potential, demonstrating significant improvement within a mere 90-day period. Here is a clear and concise action plan to guide your next steps. First, diligently review your current medications. Ascertain whether you are taking metformin for the management of type 2 diabetes or a proton pump inhibitor, PPI, such as omeprazole for acid reflux symptoms. Second, meticulously examine your vitamin B12 supplement. Identify the specific form it contains. If the label indicates cyanocobalamin, it is strongly advised to transition to a methylcobalamin formulation, which offers superior bioavailability. Third, carefully assess your B12 dosage. If you are regularly consuming more than 1,000 micrograms daily, you are very likely taking an excessive amount, which may not be effectively utilized and could contribute to the issues discussed. Fourth, promptly schedule a homocysteine test. Contact your healthcare provider tomorrow and make a specific request for a homocysteine level test, alongside an active B12 measurement. This proactive step can provide invaluable insight into your cardiovascular risk. Fifth, incorporate supportive B6 and folate supplementation. These two vitamins work synergistically and are indispensable partners with B12 in the proper metabolic processing and clearance of homocysteine from your system. In summary, the critical insights you have gained today are multifaceted. The use of metformin alongside B12 supplementation can create a dangerous interaction by impairing the intrinsic factor pathway, leading to the accumulation of elevated homocysteine and subsequent arterial damage over time. Proton pump inhibitors, by reducing the necessary acidic environment for B12 absorption, establish an erratic processing landscape that profoundly disrupts the delicate homocysteine cycle. Crucially, homocysteine levels are almost never included in standard blood panels, rendering elevated levels in seniors a significant and widely under-recognized cause of stroke and other cardiovascular events. The effective solution is not to cease B12 intake entirely, but rather to strategically switch to methylcobalamin at a more appropriate and targeted dose, augmented by the supportive roles of B6 and folate. This knowledge represents a powerful tool for maintaining health. If this discussion has illuminated a previously unknown danger, sharing it with someone over 60 who is currently taking these medications could genuinely protect them from a potentially devastating stroke. Your active engagement in health education is invaluable. Please remember that this information is intended for educational purposes only and should not be construed as medical advice. Always consult with your healthcare provider before making any modifications to your supplement regimen, particularly if you are currently taking prescribed medications. Thank you for entrusting your health education to this discussion today. You now possess crucial information that most individuals have never been told, and this vital knowledge deserves to be shared with the people you care about. Prioritize your heart health and continue to seek informed guidance for your well-being.